Could you share with us a memorable experience where empathy actually make a big difference in patient care?
I did had not one but quite a few, because we treat like as young as 5-6-year-old to
so young.
elderlies. Yeah, but even 5-6-year-old, we do advise them to come back every 3 to 6 months for a checkup. Yeah, so as you know, children, they hate dentists.
It depends on how the family raises them, but most of them,
But
yes,
most of them, they will be
they are
very afraid. So what we usually do is go by little, introducing something very little. And next thing you know, we can actually do extensive treatments, such as placing crown on a baby tooth.
Oh, why would a baby tooth need crown?
That's another story, but baby teeth are smaller. So when there's a small decay happening on a baby tooth, it kind of get extensive pretty fast.
Okay, right.
So what we do, especially when there is a decay in between the teeth, we will try with a filling first. But if the filling doesn't last, the next option, usually what I propose, is to having a baby crown done. Because if, let's say, the filling comes off, then we need to redo it, and every single time when we're redoing, the hole's gonna get deeper and deeper and bigger and bigger. It will end up into the nerve.
Okay.
And we do actually perform root canal treatment on children as well.
Wow.
We don't just pluck them up when it's not ready.
Okay.
So what happens is that after a root canal down on a baby tooth, like adult teeth, we have to crown them anyways. So what we usually propose is we don't wait until the cavity reached the nerve. When there's a small cavity where the nerve is still alive, might as well just place a crown, so we don't have to worry about a new cavity forming.
That's important, because if the nerve is damaged, then is that damage permanent? Or
once the nerve is damaged, means the bacteria is already in the nerve, and they will go all the way up, down, or up if it's the upper teeth. But what happens is that, let's say this is a baby tooth, the adult tooth is growing right below. So imagine if the infection is going down, it will affect the growth of the adult tooth as well.
I see.
Yeah, if it's very serious, yes, we will consider having them pulled out. But nowadays, we don't really recommend to even pull out a baby teeth when they're not even ready.
Oh, okay. So kids can be chill about it. It's not 100% we have to pluck out, because you guys will try your level best to preserve their teeth.
Yes.
Okay. Number 7, right? What advancements or trends in your field are you most excited about right now?
I would say digital dentistry.
Digital dentistry. How does that work?
So digital dentistry can be as small as replacing a normal impression into a digital scan. That can be, it's actually a very, I would say, a very good invention in dentistry, in a sense that patient can actually see how their teeth looks like in a 3D scan, because you can't actually take it out and see it yourself.
They are not using a mold traditionally.
No.
It's like LiDAR, where they can scan your teeth and let you have a 3D image of. Oh.
And from there, what we can actually do, we can design, like, for example, a digital smile design. We will design the smile digitally so that patient actually can see them before having that. Yes. Also, for it does advance so much that it does a lot on braces as well. Unlike the traditional metal braces, nowadays we do with digitalized braces treatment, where we can actually see from the beginning to the end how it will actually end before you even begin. So it's like, I would say, more controlled and more advanced technology.
For this kind of digital braces, you guys mentioned about visualizing the entire journey, right? Will it take longer or shorter than traditional braces? Because as other patients told us before, traditional braces, depending on their condition, some might go as long as 2 years to keep the braces on. How about this?
It's a little bit different. I would say the mechanical thing is a bit different, but in my personal experience, as long as patients are wearing them nicely, because the metal braces will be like a fixed, but this is a clear aligner where you can actually remove it.
Okay.
So it can be faster
Mm-hmm.
and also slower.
Depending on
say-
how diligent.
So fixed braces, you can't take it out.
Right.
But clear aligner, you can take it out. But as long as you're wearing them more than 20 to 22 hours per day, it can actually somehow be faster than the traditional braces.
Right.
But of course, different scenario might actually delay the treatments. But yeah.
Okay, understood. Right, next question. How do you ensure clear communication with patients, especially when language or cultural differences exist?
Because me myself, because I'm not a local, I'm Korean.
Oh,
I do
okay.
see a lot of like Korean patients coming back.
Mm-hmm.
Of course, the communication is not an issue, but let's say, for example, we have like a local patients coming in or foreigners coming in. I like to always take their teeth photo to show them how their teeth are like, and use that with diagrams or pictures to show them what we actually need to do, so they will kind of understand what's going around.
Right.
Of course, if like the language itself is very different, I might need to use Google Translator sometimes.
Okay, understandable. Same goes for us as well.
Yeah.
Right, the next one. If you could give one piece of advice to patients about maintaining their dental health, what would it be?
Like I mentioned earlier, prevention is always better than cure. So come to see your dentist regularly.
Okay.
So if there's anything, we can treat it at the earlier
As soon
stage.
as you notice it. Okay. I have one personal question, because on social media we see a lot of information being fed to us, and one of the information that I was fed is that we shouldn't brush our teeth right after drinking coffee. Is that a fact?
It's a fact.
It says that we should actually brush our teeth only after at least 30 minutes to an hour after we drink coffee, because the acidity on the coffee, and if we brush with toothpaste, it's going to drive it deeper into our teeth. And does it work like that?
Not really, but the acidity part, yes, because when we're drinking something like coffee, soda, or like orange juice, anything that is acidic, what happens is that the pH level in our oral environment will drop.
Okay.
As you know, our teeth has a lot of calcium, fluoride, everything inside, and it will always undergo a cycle of recharging and decharging. So when the environment is very acidic, they are actually losing.
Oh.
And imagine if you're brushing on, so it means they are in a very weak stage. And imagine you're brushing them, it will kind of like remove a little structures of the tooth. That is why we want you to wait until they kind of recharge, and this recharging process takes around 20 minutes.
Okay.
So
minimum 30 minutes after.
It will be much better.
What about having breakfast before brushing your teeth, or should we brush after having breakfast?
I would personally advise to brush after, because you had your food, breakfast. By right after having any food, you should brush your teeth.
Right. After every meal.
By right, yes.
By right.
Yeah. Although it's a bit difficult to keep it,
yes,
we do advise to have your teeth brushed right after the meal, like just 30 minutes after the meal. Brush your teeth. That will be the best.
And flossing.
Flossing, yes. At least floss at night. If it's difficult to floss after each and every meal, at least flossing before sleeping. That's the minimum you should do.
Okay. The last question, I'm going to skip it. Another personal question. For flossing, right, we heard of some type of devices where it pumps jets of water in between your teeth. What's that called, and how does it help in equivalent or better than flossing?
Alright, we call that as a water flosser. The name calls flosser, so people actually kind of get mistaken that it can actually replace a floss, a normal floss, but it doesn't. Because water flosser cleans between the gum and the teeth. But normal floss, actually, it cleans between the teeth.
I see. So in between the teeth, you will need a flosser to go in and move all the gunk out. While the water flosser is just between the teeth and the gum, where usually all the plaque build up, right?
Yes. So by right, you should do both.
Okay. All right. Do you guys have water flosser sold here?
Yeah, we do have.
All right. Okay. And then that will be it.
All right.
Thank you very much. So how was it?
I think I don't know what I said last, and I think talk like a bit too much